This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning. Welcome to the show. As always, a pleasure to have your company for the next hour here on our Health Watch program, which, as you know, we do every Sunday from 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly and I are taking time out from our holiday shopping to be here with you for the hour, okay? So we're actually saving money.
Maybe, John,
right,
you know.
Maybe. But good to have you with us as always. Plenty to talk about today. Dr. Molly Fantasia, the PhD doctor, executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. We'll talk about the who, what, when, where, why, and how of what Innovative Medical Associates is all about. And, of course, I mean, it goes without saying, we're going to have to talk about COVID and Omicron.
Oh, my goodness.
We'll talk about that as well. I mean, we may be talking about this, Dr. Molly, forever. So we'll get into that.
I don't think we have enough Sundays in the calendar year.
That's right.
It's unreal.
So we'll talk about that as well. And, of course, whatever you want to talk about. You have a particular medical challenge you want to run by Dr. Molly, 855-839-1210 is our number here in the studio, 855-839-1210 at any time during the course of the show. If you have a question or a medical challenge, like I said, you want to talk to Dr. Molly about, that's when you pick up the phone and give us a call, 855-839-1210. Before we get into the word of the month, Dr. Molly, Omicron, we're going to talk about innovative medical, and no matter what, COVID or non-COVID, what you do and how you help people.
Well, John, we go through this every week because no matter what we say, people still want to know what the heck do you do over there. And it is difficult to really wrap your head around. But actually, we are a group of healthcare providers, the entire group, physicians, therapists. We all work out of my facility, which is a licensed primary care facility in the state of New Jersey. But our belief system is a little different in that we don't just want the physicians to write a prescription for whatever kind of challenges you're having, but we want to improve your quality of life and probably and helpfully reduce side effects of many of these prescription meds. So we can do anything a regular primary practice can do. We can write a prescription for you, but we like to approach this by utilizing God's ingredients, natural products to augment your prescriptions. That being said, it's how we deliver them that makes the difference.
You deliver via IV.
Exactly, hydration. So, for example, everybody's talking about antivirals right now. That's sort of prudent when we talk about COVID. Yes, we can deliver traditional antivirals, and lots of times that's delivered by IV anyway. But what we like to do is augment with natural substances. So, for example, you can find the substances we use in health food stores. But it's the extracts that I use that make the difference in how outcome for a patient.
All right, so when you set this up for a new patient or a recurring patient like myself, when you set this up, what goes into what you put into the bags? I mean,
right.
I guess everybody's different, obviously.
Of course, you've seen it.
Right. I've seen it. So how do you construct that for a patient?
Obviously, what we want to do is initially, and I have plenty of conversations with my medical directors, both who's internal medicine, family practice, and also an anesthesiologist. So we look to use appropriate nutraceuticals to effectuate a change, improve the quality of life for a patient, and never put them at medical risk. That's the key. That's the key, John.
Okay. And in the case of what you're doing, it's a supplement
usually
to a prescription.
Correct. So
which can have side effects.
Right. So if you come in on 10 particular pharmaceuticals and we can help you get off 5 of those and still maintain your blood pressure and your lipids, have we done our job?
Absolutely.
I believe so.
Yeah, sure.
We're never going to tell you to throw away your medication. That you will never hear in my clinic. what might happen is after a conversation with Dr. Mark, we might say, how about reducing some of these, and this is how we can do it. But I also want to caution people because, I found myself this past week with several patients who said, I just want to get off of everything. Well, it's not, and I did it. I said, you did it. Your blood pressure was like a zillion. You didn't do it. What you've done is put yourself at more risk. Now you got to go back on your medication, and we don't advise you to do this alone. You really need to work with us in order to do that, John.
You've often said, don't just, and people do it.
Oh my
Don't
goodness.
just stop your meds.
Yeah.
And how many times have you had patients say, Dr.
I'm
Molly,
not taking it.
You know what, made me feel funny. I
Right.
just stopped it. Well, wait a minute. Hold on a second.
Stop. I always worry about rebound, which means it could come back worse. The condition can come back worse. You may not have really stopped the right medication. You know what else I love? Yeah, you bring in 5 particular pharmaceuticals, and you tell me the one you stopped, that was the one that was least, giving you the least amount of problems. Do us a favor. Don't just stop your meds. Bring them in. People bring in bags and bags of nutraceuticals or the
Right.
natural products.
Right.
Now I'm finding that people are bringing in lots of their pharmaceuticals too, because I think thanks to you and our show here, we're actually educating people not to just stop their pharmaceutical.
I should know better. Several months back, I stopped one of my meds.
I remember.
And like maybe 2 weeks, and then all of a sudden it hit me.
Right.
And I remember saying to you, can the doc prescribe it again for me? And you did, and I'm fine. But I know better. I'm doing the show with you.
Right.
But
See, don't do this alone.
Yeah, right.
Don't do this alone. There are ways to safely cut back on your medication if it's prudent to do so, medically prudent to do so. And that's why you want a little advice, and that's what we hope we give you.
Let's get back to the hydration,
Sure.
which is the cornerstone of your entire practice. People, of course, undergo the hydration therapies. All of them are different.
Many
you
times.
You have over 600 protocols.
I do.
So, you have something for just about any situation that may come up.
To improve quality of life.
Right. But what can you expect when you come in, and this always happens on your initial consultations? People say, okay, well, if I start, how long am I coming here? How long am I doing this for?
Hello, yes. Yes.
They've been sick for years. Now, all of a sudden, they want to get better in 3
Here's
weeks.
the thing, John. This isn't a one situation and done situation. This is not a spa. This is a medical procedure. This is a medical facility. And we want the patient to understand, usually one IV doesn't do it. It may take a series. But I can tell you, people start to feel better somewhere between 5 and 15 treatments, depending on what it is we're trying to do. And when I say feeling better, I'm not curing cancer. We're not curing cancer, but cancer is a good one to start with. We can improve people's quality of life while they're going through traditional cancer treatment or no cancer treatments, and maybe the physicians have told them that there's nothing else they can do for them, and they finally come to us. So I would say between 5 weeks and 15 weeks, people say they can absolutely feel the difference and their quality of life has improved.
And after the 5 or 15 weeks, you can continue if you want to do a maintenance thing.
Right, and we reevaluate, and that includes how many times a week you come in. Obviously, if you're in stage 4 cancer, you don't come in once a month, right? Especially if the doctor's told you you only have 2 months to be with us on this side of the world.
There's no more we can do for you. That's usually what they say,
I know. But sometimes they actually give them a time period, which always just makes me so sad because I really believe there's hope all the time.
What did they tell you 25 years ago when you started your practice?
I know. That's right. I just had that conversation with a patient this week. Absolutely. Look, my whole philosophy is we must continue to give out not only my protocols in terms of the IVs, but in addition, everybody needs a tincture of hope and loving kindness, period.
And in a lot of cases, you deliver the goods, but that gives you hope when you start to feel a little better.
I hope it gives you hope.
Yeah, how many times people come into you and they're really a lot of times in bad shape.
Well, we'll talk about COVID, but it's like having all this negativity thrown at you all the time. I would say, John, most people feel that after a while, when you hear so much negativity, this includes me, you start to feel like, well, there'll never be any hope. But you know what? We always have to put our faith where it belongs, in his hands.
And in particular, and we're going to talk a little more after the break about COVID, but in particular now with another strain and a discussion of another strain, talk about, really scaring people and
unbelievable. It's just unbelievable.
Right. I mean, you had a hell of a week.
I did. I did.
With regards to that. So
I really did. That's the only way to say it. It was like, wow, the angel of misery started to come around. And I said, what is going on here?
I mean, you're pretty good walking around the clinic. But the other day I saw you and I said, oh, man, what's going on? You said, what a week. You were just shaking your head.
What a week.
So anyway, we are coming up on our first break of the morning. And our show is called Health Watch, and we are here every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. We've been talking about the who, what, when, where, why, and how of Innovative Medical. And we've mentioned the word COVID and Omicron and all of that stuff. But Dr. Molly has some good stories to talk about, not only related to that, but related to some other conditions. And we always like to talk about that because it shows in real life what Dr. Molly and her staff can do. So we'll talk about that and whatever you want to talk about. 855-839-1210 is the number here in the studio, 855-839-1210. I'm your host, John DeMasi, with Dr. Molly Fantasia. We're returning more of today's Health Watch after these words. Back here on Health Watch, as always, operators standing by at Innovative Medical Associates. And they are there right now. If you want to call and get more information, you're a little bashful, you don't want to come on the radio, or you want to talk to them, they can give you as much information as you like. And you want to set up an appointment to sit down with Dr. Molly, that's really where you can get a lot of your questions answered. You call that number right now, 856-489-0505. 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And again, that initial consultation with Dr. Molly is complimentary, and you'll find out a lot during the course of that time. 856-489-0505. Check out the web, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. You get a lot of good information on that as well. Health Watch is our show, Sundays 8 till 9, Talk Radio 1210, WPHT. And again, Dr. Molly Fantasia is here, and we're talking about a variety of things. And, we're going to talk about a couple of different patients, but Dr. Molly, this one particular patient, again, really a difficult case, but some positivity here.
Right.
Gary.
Gary.
What's Gary's story?
Well, Gary came to me in 4-stage cancer, and it spread to the lungs as well as the liver. And so he was accumulating a lot of fluid. And his wife, wonderful, wonderful people. I suggested that they call their oncology people and have it drained, and she indeed is doing that. You can drain off ascites in various spots. In fact, I had another patient who has breast cancer, and I pushed to do it. But obviously, one of the objectives is to try to slow down the fluid accumulation. And what happened this week was Gary went in, and he's been going every week for this drainage. He went in for the fluid drain, and the nurse that took it off showed the doctor, and he went from 3 liters the last 4 times to now 1.2 liter. That's half almost. And actually, it's a little less than half of fluid. And they said to him, I don't know what you're doing, but you better keep doing it. And it was very unexpected. So he was a little bit upbeat for a change. And, he's been hearing that, it's just going to get worse. And he's, they're not going to be able to drain. It's going to be too much fluid. And I said, let's just stay the course. And one of the particular treatments that we have, and again, it's for a quality of life. It's not to cure the cancer. It's none of the above. But I use a particular homeopathic treatment that I put together along with some nutraceuticals that help the lymph nodes help the lymphatic system do its job, which is to help clear out this fluid systemically.
Typical of many of the patients that come to see you, he comes in and they gave him a couple months or
well,
whatever it was.
they said, there's nothing more that conventional medicine can do for him. Now, wouldn't I have loved to have him as a patient while he was doing his conventional medicine? I would have really loved that. And I think one of the things that Gary's taking away, and certainly that Gary's family's taking away, is let's get in earlier in our cancer treatments. And I really want to urge people to understand that we, meaning my physicians and myself as a scientist, we don't want to do anything to upset your normal cancer treatment should you choose to do it. We want to give you an option that makes you feel better through it. That's the bottom line.
So can you explain what you did and how that was helpful in terms of this less fluid?
Well, I used
the IVs did that.
I used and you would think that would give you more fluid. Well, first of all, you have to be judicious in how much fluid you're going to give him in any setting.
Right.
And you watch the bags.
Yes.
Do I have bags that look like tiny bags all the way up to big bags?
Big bags, yeah.
Okay.
Well, I usually get a big and a tiny.
Well, yeah. Well, you have a special protocol. But the point I'm making is that you do everything. There's a method to what I do, and it's the methodology that is proprietary. So here's the thing. We delivered some homeopathics and homeopathic dosing to help improve his own lymphatic system. That's what helped. In other words, his own body was compensating and making less fluid.
All right, so that's one case, and I know that, we have so many things to talk about today. And again, if you have a question for Dr. Molly, a medical challenge, 855-839-1210 is the number here, 855-839-1210. When physicians come to you, I guess that makes you feel good. And you had this PRP case this
right
week.
Now that again is platelet-rich plasma, which falls under regenerative medicine. But this was an interesting case because one of friends of our clinic is a neurosurgeon, and she's very well respected. She has a special needs young adult child who actually had a she had a tear in her knee. And so she had spoken to me about it about a week or so ago. As a matter of fact, she and her colleague, who's an orthopedic surgeon, they said, you know what, Mal, why don't we come in and what do you think? You think you could put together a protocol again using the PRP, which is the platelet-rich plasma from the patient themselves, and they would inject, which made sense to me. They should come over to the clinic and inject their own niece and have her mother there.
Right.
Well, indeed, I have to say that we worked. It took 2 hours because it was very difficult to explain to the young lady, who, by the way, is very smart. By the time she was done, she said she was going to work for us, and which we enjoyed very much. But the bottom line is we were able to deliver the PRP. I saw her mom, again, who is a neurosurgeon. I said, how did she do? She said, well, she had pain the first 2 days, which we expected because we're promoting inflammation in that case. We're promoting the body's healing powers in that case. But afterwards, she said she's doing pretty well. So I was delighted to hear that. Of course, she had the top-notch orthopedic surgeon delivering that injection, which also helped. So, the ability of our clinic to do these kinds of things is what separates us from a lot of other people.
And you've often talked about, and I like when you call them drunk tanks, because you've often talked about those, and they're clearly
not
360 degrees from you.
Exactly.
And sometimes I think people can't quite get that.
Do you know what? I had a situation this weekend where someone told me, because we're doing the show from down here, hey, why don't you guys set up a situation where you go into the hotel rooms and take care of people after party? And I said, that would be the furthest thing from my philosophy. I know people are doing it. There's a big sign on the expressway. People are doing it.
I saw that, yeah.
Okay, listen to me. I have no problem. I said, call that whoever the hell that is, call them. But the point is, we're doing doing real patients with real challenges. And this other side of the house is if you want to maintain your health, we're the place to come to, not after you drink yourself silly or whatever.
Yeah, I had an uncle who had a little bit of a problem with alcohol, and he always just drank tomato juice the next day.
Yeah, that's true. Loaded up with the electrolytes. But the point I'm making is, can we do that? Have we done that? Sure. If somebody's a patient of mine and their child got married and the next day they weren't feeling so good, of course we took care of them. That's not my point. The point is, what we want to do is we want to effectuate change for a person who has a problem, and we want to maintain health for people who don't have any problems, so they don't have to come in and get some IVs that are specific to a challenge.
Well, I think the key is here, and you've often said this, you are a medical facility.
Absolutely.
You truly are a medical facility.
Absolutely.
And not to be confused with some other
spas or whatever.
And that kind of thing. You go in there and you have all those fancy little fountains and stuff like that.
No, not even that. I mean, listen, our facility's pretty good looking. We don't have a fountain, but we're pretty good looking. Right. But the point is, we really treat it. Listen, we treat this as a medicinal protocol. And
that's really what a lot of the patients need when they come to see you.
And I actually think a lot of the patients appreciate it. And they'll call. I mean, listen, we've had calls on this show, right, where people have said they felt better. And that's really my objective. I want you to feel better, and I want you to live a high quality of life. Look, conventional medicine cures, so they say. They say they cure, right? Okay, great. But what's the difference if you have a cure and you're confined to a wheelchair and you can't move around, you can't enjoy your kids, and you can't enjoy life? We're all about enjoying life, too.
And you've often said that. You've said that on the show many times.
Well,
quality of life is really your goal.
That's
for patients, no matter when they come to you.
Regardless of when they come to me. But it would be so much nicer if someone would start their cancer journey with us as opposed to later in it. Just one area.
And that would make a difference?
I would say it would make a huge difference. You've seen it. I have people who do conventional treatment. And now, don't misunderstand me. We meet a patient where they are. I have several long-standing patients who did nothing conventional and are doing okay.
Right.
But, I believe that's in God's hands, not mine.
All right, so I guess the point here is at least come to you and get the consultation so you can get the information, and then you can make an informed decision. And, I think under this situation with COVID, and we'll talk about that in the next segment, it's just worse than ever because people are running around in fear. One thing I know for sure, John, whatever the diagnosis is, you can't sit in inertia. You must do something for yourself to protect your quality of life and to protect your family, meaning you'll have some interaction. There's no point in sitting at home and in a dark room and saying, oh, well, let me cover my head and not think about this. No, you have a problem. Let's address it and move forward. All right, we're coming up on what we like to call halftime here, our halfway point of the show. And certainly we have plenty of time to talk about whatever you'd like to talk about. 855-839-1210 is the number here in the studio. And you know what we say every show at this point, if you want to call in, now's the time to do it. Call in early because usually what happens is people call in and we have 2 minutes left of the show and we have to rush through it. So we don't want to do that. So you can call now. You have plenty of time to discuss your situation. 855-839-1210 is the number here. 855-839-1210. Our show is called Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We return more of today's Health Watch after these words. And we're back here on Health Watch. Dr. Molly Fantasia here, of course. Got to watch that, Dr. Molly. You put your headphones by the microphone.
Oh my goodness!
That causes feedback.
Oh, good.
That'll wake up the audience if they have. Anyway, operators standing by at Innovative Medical Associates, 856-489-0505. 856-489-0505. That is the number. You got a question for them, you want to set up an appointment. Really, that's what you do. Set up an appointment to sit down with Dr. Molly, and you get, most of your questions answered, and then you have the information you need, and you can figure out where you want to go from there. 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Also, we were kind of joking earlier in the show about holiday shopping. Well, here's a great gift. Dr. Molly has written her latest book, God's Ingredients TOO. God's Ingredients 2, My 30-Year Journey in IV Nutritional Medicine. For the person who has everything, you can give them the gift of information that could lead to good health. I mean, that's really the bottom line there. So a nice holiday gift available on Amazon.com or anywhere you get books. It's God's Ingredients TOO, Dr. Molly's book, My 30-Year Journey in IV Nutritional Medicine. 30 years. Did you think you'd be doing this for 30 years?
Not really, John. But every day's a joy.
Absolutely.
Every day's a joy.
You didn't think you'd be doing this at all because
that's right.
Based on what
what I was told. That's
you
right.
were told. Yeah.
That's
guess
right.
what?
Yeah. Amen.
You're going to check out of the hotel.
Amen. Amen.
All right. 855-839-1210. We're going to go to the phones. Let's start, Jim. We're going to start with Christine in Plymouth Meeting. Christine, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Christine.
Hi. Good morning, doctors. Thank you for taking my call.
No worries.
I have a very young 95-year-old mom. She's got it.
God love her.
And she's, God bless her, so thankful we still have her. But her knee is bone on bone, and she's suffering terribly. And the doctors say there's nothing they could do. They won't do surgery because of her age. And I'm just wondering if there's some way we could help her.
I think there's a couple of ways you could help her. First of all, I think one of the things I would want to do is she's in good shape in terms of blood count, et cetera. I mean, all of her numbers in terms of her lab work are fairly good for her age.
Yep, it's amazing that she is.
God bless her. And does she get around? Yeah, does she get around other than the knees, my dear? Does she get around other than the knees?
She would if she could, but that leg is terrible for her.
Okay. So one of the things I would do, if you don't want to do anything using like the stem cells or the PRP, which we spoke about in the earlier thing, which include injections, I would put her on a regimen. And if you call my office, I'll give you several nutraceuticals that I would put her on to help maybe the inflammation around the knees and in the joints, etc. I mean, 95, God bless her. I mean, she's been exposed to a whole lot of inflammation. I'm sure she was a hard-working woman too in her heyday, right? So I'm used to this. But I think there are many, many things. The other thing I would do is, now she's a good candidate, believe it or not, for our high-dose IVC protocol. So if you could bring her around, we would happily take care of her. And if you call the office and you give us, your number, I would have Barbara, one of my registered nurses, give you a buzz back and possibly give you some nutraceuticals that you could give to your mom at home as well. Okay?
Well, that has something to do with the bones? With the bones?
Yeah, absolutely. Does she have osteoporosis? Is that part of the problem?
No.
Thank God. Okay.
She had hips replaced, her other knee replaced, and this is the last one, and they won't do it.
Well, because of the age, you can understand it's probably a difficult surgery at her age anyway. But I can certainly give you some. I could actually, in the IVs, give her the anti-inflammatories that I know could help. It would help her, give her a little quality of life. Call the office. You're a nice lady.
Christine,
God bless you.
Thanks a lot for the call, and good luck with that. Let's talk to Aaron in New Jersey. Aaron, good morning. You're on Health Watch with Dr. Molly.
Hi, Aaron.
Hey, hello there. Hello, my name, obviously I said it was Aaron. I'm a pastor, been pastoring for over 20 years now.
God bless you, Aaron.
I have something that comes up with, I think, pastors often is obviously high stress along with doctors.
Yeah.
But
yeah.
I've been dealing with, I believe the simplest thing, I know it's small, but would be acid reflux constant. And obviously I observe a lot of, and I'm not saying all medical doctors don't help, but I mean, we've got case after case all the time. I'm always, dealing with people with cancer, and I'll be honest with you, I don't see, being in the hospital and all the way to the funeral, I don't see where a lot of what they are doing works very often. And it just seems like it destroys them so much faster. And I would rather go with something more natural. And I've tried a lot of things, but tell me what you think you could do.
Well, first of all, Pastor, I want to thank you for the work that you do. And I have several pastors who are patients in our clinic. In fact, the joke is, on certain days, I feel like there's so much prayer going on. It's no joke. People are feeling better just from the God blessings that we get in the facility. But I would tell you, Pastor, one of the things I would do is high dose vitamin C for these people. Also looking at a lot of particular homeopathics, and I'm a big believer in God's ingredients. There are many, many things that can help people through their cancer journey. I think the other thing that's extremely important is that, we can't say something is hopeless. I'm a believer that we don't know how much time anyone has, but we can make the most of the time that they do have. And that is what we systemically do at our facility. And we use things like, and I'll go into some of these anti-inflammatories. We also would go through, we want all of our cancer patients to absolutely be completely keto, so to speak. We want them to stop taking sugar. The conventional physicians, if you ever go into any of these places, they have bowls of candy out and all of this in the chemotherapy suite. If you look at the non-conventional physicians, I'm talking about MDs, PH.Ds, people like myself and my docs, you will find that we know cancer feeds on sugar. It is metabolically not good for people. Now, we're not going to tell them to give up everything, but we are going to work with them to try to straighten out some of their nutrition. But the other problem is they become so malnourished during their cancer treatments, and that's the other area we can help them with. So, yes, vitamin D is extremely important. Bivoflavins are extremely important. We have a very good protocol for various cancers, Pastor. Please call my office. And as far as your, we like to say in Italian, we call what you have agita, which is heartburn. And I'm very familiar with it. I actually call it a pastor's condition. So I'm going to tell you what to take for that. And there is something that God puts out that's excellent. If you take an ounce in the morning and maybe an ounce before bed, I think you'll get some relief. Won't cure it, but it'll give you some relief, Pastor. Okay?
Okay.
Thank you.
Ma'am.
God
Pastor,
bless you, sir.
Thank you for the call. Appreciate
Thank
it.
you. Keep us in your prayers, Pastor.
All right.
Thank you.
855-839-1210 is our number here. I want to get back to Christine talking about her 95-year-old mother.
Yeah.
Do you remember the patient? You remember years ago she was...
Oh, 102.
102.
Yeah.
And she started when she was around 95.
Yes.
So you had her for about 7 years.
Right.
And I'll tell you what, she did not look 102.
Well, she came in. Now I will tell you, she had to walk on a walker because she was, up there. Her daughter brought her in, and she sat in the chair, and we gave her some drips. She was pretty lively by the time the drips were over.
That's right.
And God bless her. I think she lived to 104.
Yeah. I mean, I remember that, and it was like, wow, you could never tell what her age was.
Well,
really
you knew she was up there, but the point is she wasn't suffering. And look, we want people to enjoy it no matter what stage of life you're in. You've got to enjoy it. God gives us this to enjoy.
Okay, 855-839-1210 is our number here in the studio. Before we come up on our next break, let's talk about Tim. Because you had sent him to the hospital.
If you remember a few weeks ago, folks, I said I had a case where I knew he had to go to the hospital immediately for COVID. Well, he's now out of the hospital. He's doing well. He's coming in tomorrow to start his post-COVID long hauler treatment protocol. And included in that protocol, I'm going to talk a little bit about something called rutin. And it's an extract that I use a lot. Again, it's a bioflavonoid, and it's found in certain things. But I'm so thrilled that he's out. And interestingly enough, his wife called me to tell me that the doctor told him, the pulmonary doctor told him, when he first saw him, he didn't think he would make it. I knew he would. With the help of God, I knew he would, because he had come in prior to this to make sure that his immune system was somewhat tuned up. But he did have some pre-COVID comorbidities that we had to address. So I thank God, because he was a good patient up until this situation where that comorbidity took it. He was a hard-working guy. He worked morning, noon, and night.
I had somebody tell me yesterday, I said, I never had COVID. I said, I get these vitamin C treatments.
No.
I got my booster shot. I got my 2 vaccines. Yeah, but you probably did. You had it. You probably didn't know it. I said, well, no, I didn't have it.
I know.
And you tested me several times.
John,
John, this is again
John,
back
now
to the havoc.
Listen to me. COVID, it has been the bane of my existence. COVID. Listen, you know that I do some occupational therapies for some good patients of mine who are entrepreneurial, and they have a fairly large company. So we've been doing the testing, and of course, you know, I work down at the Atlantic City Mission, and we've done the testing down there with COVID antigen testing. It's a rapid test. I had people coming in there insisting, yes, they tested positive 2 weeks ago. They've done the at-home situation, and now they're testing negative for the antigen. That's to be expected. Do you know that they told me they didn't want to go back to work? They didn't want to go back to work for my patient's company, right?
Yeah.
Okay, and he's paying for their COVID test. So guess what? I said, I don't know that you don't want to go back to work, but I'm telling you, you're cleared from our standpoint to go back to work. So, I mean, this is the thing. People are insisting they have COVID when they don't have it. You can have a flu, you know, and we can test for that. You test positive for a virus or the flu. That's not COVID.
Right.
Okay,
it's just isn't it like it's crazy these
right
days.
Now, I'm telling you, I am so worried about this new thing that they have so much fear. Fear is a disease in and of itself.
Absolutely. Well, with that, we're coming up on our final break of the morning, and that means you still have time to jump in with a question or two if you have that, or you have a medical challenge, if you want to run by Dr. Molly. 855-839-1210 is our number here, 855-839-1210. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We return, more Health Watch after these words. And we're back here on Health Watch. Operators standing by right now at Innovative Medical Associates. And like we always tell you, you know, the operators work all day. We leave you at 9 o'clock, but they're there, all right? So you can call. You want to call now, you want to call later on, feel free, 856-489-0505, 856-489-0505. That's the number for Innovative Medical Associates. You call, you get the information, and, of course, you want to make an appointment to sit down with Dr. Molly. Remember, the initial consultation is complimentary, 856-489-0505. The website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And don't forget, if you miss any of today's show or you heard it, you want to hear it again, we have our Health Watch replay every Sunday from 4 until 5 here on Talk Radio 1210 WPHT. And, of course, it's our live version of Health Watch every Sunday, 8 till 9. Again, Talk Radio 1210 WPHT, 855-839-1210, our number. Let's talk to Rich in Cape May. Rich, good morning. Yeah. Welcome to Health Watch. You're on with Dr. Molly.
Hey, Rich.
Good morning, Dr. Molly.
Hey,
I just
Rich.
wanted to ask you, I'm Lana's husband.
Yeah, we know who you are. I mean, come on, you're famous, Rich.
You're part of the family, Rich.
That's right.
Forget about it.
Yeah, and lucky.
Lucky,
what I want
too.
to ask you is, you know I have a whole lot of medical issues.
I know.
And I just coming out of COVID a few weeks ago.
Good.
But my main issue is depression.
Yes.
And I'm under a lot of medication for it.
Right.
And I'm still depressed. What can you?
I think Rich,
if I can get.
yeah, I think you're right. I think, look, we know that depression is very difficult to treat. And I will never tell you to stop your psych meds, so to speak, or the brain meds. You need them. You need them. But we can intensify some of those to help you. I think vitamin D is extremely important. And I think in a situation like yours, we definitely need to make sure we measure that and maybe give you a loading dose of a higher dose, maybe 10,000 units or so, in addition to what else? Vitamin C, of course. And there are several other homeopathics that I would like to use. And, there's another thing out, Rich, that we can talk about in the office. I can send you out for a specific scan that's done in New York City from another clinic, and I would happily like to do that because it can give us some live information as to what's going on in the areas of the brain that are affected for you. So when you come in, if you're coming in this week or next week even, let's sit down and talk a little bit more. Depression is so difficult and such a nebulous kind of thing. And I'm going to tell you, it's not helping that you're off of COVID because there's a whole group of people who are suffering from depression as part of the long hauler syndrome. So if it feels like it's a little worse than ever, Rich, it could very well be the post-COVID syndrome. So let's give yourself some time. And I do have certain homeopathics that I'm delivering IV that I think will help the post-COVID depression piece. So yeah, come on in and see me, babe. Okay. God bless you, Richard.
It will be this week, God willing.
Okay.
God
all right,
willing,
Rich. Good luck with that.
What a wonderful guy he is.
Thanks for the call.
He's got a wonderful wife. Go ahead.
And famous with the dog.
Famous dog.
I mean,
yes.
that's a great. He brings the dog. That's a great dog.
Well, he's a very good therapy dog.
Right. Exactly. All right. Charlie's in Philly. Charlie, good morning.
Hey,
You're on
Charlie.
Health Watch with Dr. Molly.
Oh, hello. Good morning. How you doing?
Good. How are you, Charlie?
I'm doing pretty good. I have a question about glucosamine sulfate with chondroitin. I took it 20 years ago. My knee and my shoulder were clicking. I work construction. I was in my late 40s. I asked my doctor. He said, well, studies have shown it does some work, but I can't prescribe it because it's not a pharmaceutical. You have to buy it over the counter.
Yeah.
It's real expensive, but I bought it, and it worked. After a month or so, my knee stopped clicking, my shoulder stopped clicking, and I told people about it. I told relatives about it, and blah, 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 blah. And I even heard President Bush took it. It was one of the things he took, and he was jogging at his age and all. And I don't hear no more about it. Is it like just like dismissed now or something?
No. It's still readily available, but there are so many other things out that actually have the component of the active ingredient, what you're talking about. But there are many things that we found now. Medicine, even nutritional medicine, is improving all the time at lightning speed. So I'll tell you what, I have several things that help people at utilizing the chondroitin, etc., but having some other effect. Right now the hottest thing is the collagen. Now, if you utilize this with collagen, I would think you might even have a better outcome. But again, I do a lot of this in the IV, and I will tell you, it does make a huge difference. And the fact that you're a construction worker, I know you put a lot of pressure on your joints, etc. Look, my dad was a plumber.
My feet are totally shot.
690 his whole life, so I understand you're out there, So please, give me a call at the office. Come in for the free consult. I bet you leave with a lot of information. You need some more anti-inflammatories. God bless you, my friend.
All right, Charlie,
Okay?
thank you for the call.
That's a great call. That's a great call because, it isn't that things fall out of, fashion. It's that things improve, John.
All right, we're going to talk to Ron in Wilmington, Delaware. Ron, good morning. You're on Health Watch
Ron.
with Dr. Molly.
Hi, Ron.
Is Ron there? Jim, is he there?
Okay.
I
guess he fell off. That's a shame.
Yeah.
Okay. Well, back to what we were talking
about. We were going to discuss the protocol for post-COVID because here we go again. Rich called and he had. I mean, it's just
and depression is one of the symptoms. So there are so many things, and as you know, Tim's starting a post-COVID protocol. Look. one of the things I want to say, and it's not all just IV that I'm doing with a patient. For example, in the post-COVID protocol, I want to incorporate enzymes. Now, you've heard me speak about digestive enzymes before, but not just at meals, but honestly on an empty stomach, because along with good probiotics, we know that affects things on a cellular level. So enzymes are going to be prescribed. We want to look at the vitamin D, and again, I'm going to address like what Rich was talking about. A patient post-COVID might need a loading dose of 10,000. We want to look at that with K2. Now, vitamin C, of course, I want to use. And again, I'm using really interesting doses appropriate for the patient. Now, you see, that's the other thing. You can't be arbitrary about dosing because you want to take into account a patient's history and other things that are going on. So you always want to go back to what? The Goldilocks theory that I talk about. But I also want to talk about these bioflavonoids. I think that there's a real need for those post-COVID, including something called rutein. You've heard me talk about this. People say, well, what the heck is that? It's actually an active ingredient, and you'll never guess in what, John? Apples. Remember the old adage about an apple a day, right? Well, rutein is one of the reasons why it works. Rutein has so many good qualities. It is unbelievable. And I actually have an extract of rutein that I think will work very well for people. And interestingly enough, it has other properties. It does other things, not just for the post-COVID. So rutein, researchers have found, may help prevent blood clots in the arteries and in the veins. And they said it's an interesting thing in the research that I read about. It's one of the only few agents that works in both types of clots. And why does that work? Because what it does is it inhibits a particular protein that is rapidly secreted when the platelets and the endothelial cells are secreting out and clumping together. Isn't that interesting?
Yes.
It stops it. It stops that protein. So that's one of the things. So obviously it improves circulation. The other thing it does, and it's been used in certain alternative clinics for fighting cancer as well. Definitely the bioflavonoids work for people who have arthritic type conditions, like the 95-year-old woman. I would want to look at this. Now, dosing routine is the thing. You've got to really look at this and say that, okay, it can boost heart health, it can help relieve arthritis symptoms, but you want to you got to meet your patient where they are. So you want to dose appropriately. So let me talk about some other foods it's in. Would you believe it's in olives? Olives.
Wow.
As in,
no, I didn't know that.
No, nobody does. It's like unbelievable. Green tea, it's in black olives. Grapes, it's in grape. That's why when I talk about grape, I talk about grape seed extract, not just the polyphenols in it. And also, believe it or not, John, it's in asparagus. And it's in what was my father's favorite, and a lot of Italians love something, a fruit, figs.
Yes, absolutely.
Figs.
Let's try to get Ron back.
Oh, good.
We understand he is back. Ron in Wilmington, Delaware. Ron, good morning. You're on Health Watch with Dr. Molly.
Hi, Ron.
Yeah, good. Hi, I'm sorry we got cut off there.
No worries.
Yeah, I'm calling because I'm having a sleep problem.
Yeah. Post-COVID or just in general, Ron?
No, well, yes, just in general. I had a operation. I had bladder cancer.
Oh.
And they scraped my bladder, and supposedly it's cured, but, I have to go through certain sessions, about 6 sessions, I believe.
Mm-hmm. Mm-hmm.
So that they can spread the medicine, can make sure that the bladder's covered.
Uh-huh.
And it starts the first part of first part of January.
Okay. How old are you, Ron?
I'm 85 years old, believe it or not.
God bless you.
You're
sound wonderful.
You're a kid, Ron.
Yeah, I was talking to some guy yesterday at the laundry, and told him that he told me how old he was, and I said, well, you're a baby compared to me.
Okay.
But I have relatively pretty good health,
Thank
over
God.
all these years.
Thank God. Thank God.
All right, we're coming up to the end of the show, Ron. So Dr. Molly's going to try to give you some information to help you out.
Well, I'll tell you, I find it interesting about the sleeping situation. I'm sure he's already tried melatonin. He sounds like he's pretty knowledgeable about some, natural substances. But, did you have a sleep study, Ron? Are you there?
Is it still there?
He's not. Okay. But anyway, there are several things to help. But I think it's interesting about the bladder cancer, John, as well. There are a couple ways to treat the bladder cancer, and sometimes you treat that with an old remedy, as you know, right?
Right.
And I'll tell you, it's one of those cancers that sneaks up on you. You don't even know you have it until the day you start bleeding.
I had it. That's how that's exactly how I found out.
I remember.
You remember that one?
I remember it like it was yesterday.
That's right. Me too.
Okay?
All right.
Okay, because I sat with you there till we got to the right doc. And as you remember, they offered.
Okay, we got to run. Unfortunately, we went a little long today.
Oh, I'm sorry.
No
John.
problem. We'll catch that. We'll pick up with that next week. That's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by. They'll be there well after we leave you today. 856-489-0505. The website, innovativemedicalassociates.com. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, Joanne, fabulous Fran, and our nurses, Jess, and our medical assistant, Karen Kathy. I'm your host, John DeMasi. Thanks for listening. We'll do it all over again next Sunday. Health Watch, 8 till 9. Talk Radio 12.